Global warming, a term often heard but seldom understood, has profound implications on our health. It's more than just a rise in temperature. It's a complex process fueled by the greenhouse effect, which traps heat in our atmosphere. This natural phenomenon is amplified by human activities, especially the burning of fossil fuels. We've tipped the scales, and now our planet is heating up at an alarming rate. Understanding global warming is the first step to understanding its impacts on human health. Global warming's direct impacts on health are as clear as daylight, yet often overlooked. The rising temperatures across the globe are more than just a discomfort. They're a serious health risk. Each year we see an increase in heat-related illnesses and deaths. These are not just numbers, they're our neighbors, friends, and family members. Heat stroke and heat exhaustion are the most common heat-related illnesses. Heat stroke, a medical emergency, can damage the brain, heart, kidneys, and muscles if treatment is not provided promptly. Heat exhaustion, if left untreated, can also lead to heat stroke. The elderly, children, and those with chronic illnesses are particularly vulnerable, but no one is immune. But the health impacts of global warming don't stop there. Our warming planet also provides a more hospitable environment for disease-carrying insects. Mosquitoes, for example, thrive in warmer climates. As temperatures rise, so does the potential range of these insects, bringing diseases like dengue, Zika, and West Nile virus to regions where they were previously unknown. Ticks, the carriers of Lyme disease, are also spreading due to global warming. Traditionally, these tiny creatures were found in the northern parts of the United States. However, milder winters have allowed them to survive and reproduce in new regions, leading to an increase in Lyme disease cases. And it's not just insect-borne diseases we need to worry about. Warmer temperatures and changing rainfall patterns can also lead to increases in waterborne diseases. Heavy rainfall, for example, can overwhelm water treatment facilities, leading to outbreaks of illnesses like cholera and giardiasis. It's crucial to note that these health impacts are not distributed evenly. Those living in low-income communities, the elderly, children, and people with chronic illnesses are most at risk. Climate change is a threat multiplier, exacerbating existing inequities and creating new ones. These direct impacts are just the tip of the iceberg when it comes to the health effects of global warming. The effects are far-reaching and complex, touching every aspect of our lives. We must act now to mitigate these impacts and protect our health and the health of future generations. The indirect impacts of global warming on health are stealthy, yet they leave a significant mark. Let's start by thinking about our food. Global warming disrupts agricultural practices, leading to food scarcity. The situation is further complicated by unpredictable weather patterns and extreme conditions, which make farming more challenging. With less access to fresh produce, many people are left vulnerable to malnutrition. This can lead to a weakened immune system, making individuals more susceptible to diseases. Now let's consider the air we breathe. Increased temperatures caused by global warming stimulate the production of ground-level ozone, a key component of smog. This can exacerbate respiratory conditions like asthma and even lead to heart attacks. In fact, a study found that for every 1 degree Celsius rise in temperature, there was a corresponding increase in the number of deaths from respiratory problems. But it's not just physical health that's affected. Global warming also impacts our mental well-being. The term climate anxiety is becoming increasingly common, describing the stress and worry caused by the existential threat of climate change. This anxiety can manifest in various ways, including sleep disorders, depression, and even post-traumatic stress disorder, particularly in individuals who have experienced climate-related disasters firsthand. Moreover, the indirect impacts of global warming extend to vector-borne diseases. Warmer climates provide ideal breeding grounds for disease-carrying insects like mosquitoes. This has led to a surge in diseases such as malaria and dengue fever in regions where these were previously uncommon. And let's not forget the social implications. Climate change can lead to displacement of communities due to rising sea levels or severe droughts. Such displacement can result in overcrowding in other areas, putting a strain on health services and increasing the risk of communicable diseases. In essence, global warming silently yet persistently chips away at our health, from the food we eat to the air we breathe, to our mental well-being and beyond. These indirect impacts may not be visible immediately, but their long-term effects can be devastating. So, let's not underestimate the stealthy health threats of global warming, because they are as real and urgent as the ones we can see and feel. While the health impacts of global warming are concerning, there are actions we can take to mitigate them. On a personal level, we can make a difference by reducing our carbon footprint. This can be achieved through small yet significant lifestyle changes, like choosing public transportation or biking over driving, conserving energy at home, and adopting a plant-based diet that requires fewer resources to produce. Communities can play a vital role in this fight too. By promoting sustainable practices such as recycling, composting, and local food production, we can collectively reduce greenhouse gas emissions. Encouraging green spaces in urban areas not only sequesters carbon, but also improves air quality, enhancing our health and well-being in the process. Governments also have a crucial part to play. They can enact policies that favor renewable energy, limit deforestation, and incentivize green technologies. They can also develop health systems resilient to climate change, preparing for the increased demand for health services due to heat waves, natural disasters, and vector-borne diseases associated with global warming. Finally, education is key. By raising awareness about the link between climate change and health, we can motivate more people to take action. Remember, every small step in the right direction adds up to significant change. With concerted efforts, we can protect our health and the planet from the ravages of global warming. The health impacts of global warming are not a distant threat, but a present reality. We've explored the direct and indirect ways global warming is secretly affecting our health, from heat-related illnesses to the spread of infectious diseases. We've seen how changing weather patterns and rising sea levels can alter our environment, our food supply, and our way of life. The problem is real, and it's urgent, but there's also hope. We've discussed actions that can mitigate these impacts, from reducing our carbon footprint to advocating for policies that protect our planet and our health. But it's not enough to understand the problem. We must act. Each one of us has a role to play in this global effort, whether it's making lifestyle changes, supporting sustainable practices, or raising awareness. Your actions matter. So let's step up. Let's face this challenge head-on and create a healthier future for ourselves and generations to come. Remember, the health of our planet is intrinsically linked to our own health. It's time to take action.